The SIU School of Medicine is a pioneer in medical education.
This is a really special place, a great place to invest in.
SIU invests in its students to be the best physicians possible.
We were the first medical school in the country to have a full-fledged problem-based learning curriculum.
It's a wonderful place to come and do what you're passionate about.
I'm glad I chose SIU, and I'm glad SIU chose me.
SIU is going to put you in the best situation.
Forever SIU.
Forever SIU.
What a great video from the School of Medicine and telling the story about truly one of the nation's great schools of medicine. So we're thrilled to be joined right now with Jerry Cruz, Dr. Jerry Cruz, the Dean Provost of the School of SIU School of Medicine, and also the CEO of SIU Medicine. Jerry's been at the school for 35 years and is doing a remarkable job. And Jerry, welcome. And I'd like to, kick off with last year, the School of Medicine won the award for most donors on the day of giving. So what are your plans to keep that trophy in Springfield?
Yeah, well, we did have a lot of donors last year. And first, thanks for having me here today. It's a pleasure. Yeah, we raised over $200,000 last year from over 300 donors. So that was really good participation. We're emphasizing this year that our theme is forward together. And that's a good one because during this pandemic year, everybody, all of our partners, the community partners, our alumni, everyone who works here has had to pull together, and we are looking forward together. So we're going to capitalize on this challenging year, and we've just made efforts to make sure that everybody knows that it's very important for them to give. So faculty members, administrators, our staff, and our students, and all of our learners as well. No matter what the amount is, we're just emphasizing that we've come through this together, and we're going to help some people if we can get those donations going like they were in the past years and even surpassing them.
Very, very cool. Jerry, it's hard to believe that this great School of Medicine is just 50 years old. You just celebrated your 50th last year, and tell us about the mission and the role that the School of Medicine plays in the region, the state, and the world.
Sure. Yeah, we only had one celebratory event last year before the pandemic hit. So, we still have celebrating to do in the 51st year. Our mission is to optimize the health of the people of Central and Southern Illinois through all the things that we do, through teaching and research and delivery of clinical care and service to the community. That mission has not changed throughout the years. It's a mission of social accountability. We must have partnerships, and we must have people that help us from the community to do those things. We're a community-based medical school. So they have, over those years, we've trained more than 6,000 physicians. 3,000 and more have graduated from medical school. Somewhat over 3,000 have graduated from our residency programs and fellowships. And we have also trained students through our graduate programs, med prep, physician assistant, and our PhD programs, the scientists of the future. That's about another 3,000. So about 9,000 altogether, that's the providers, the scientists, the healthcare professionals, and through the med prep program, one of the greatest diversities and institutions of inclusion in the entire United States. So yes, it's been a good 50 years. I'll just say one more thing, is that we do have all those alumni, 9,000 or more now, and the importance of giving back by the alumni and them acknowledging what they've gotten from the school and us acknowledging that they are the mission fulfillers that we have is a mutual partnership that's very important. So we challenge all of them to remain our partners, and we'll give our pledge that we'll remain their partners.
Wow, Jerry, all in just 50 years, and you're based in Springfield. You have residents in Carbondale, and certainly then you have locations throughout the state. So I believe you serve nearly 80 counties of the 100 in Illinois alone.
That's true. Our service area historically has been the 66 southwesternmost counties. And then we have so many graduates in another 14 to 20 counties that go to the northeast of that. We consider that part of our service area as well. So in that area, there are 2.5 to 3 million people, and 70 or 80 counties. We've taken that mission to heart. There's no doubt about it. I'll just have to say this: there are some awards that acknowledge that. The SIU School of Medicine a few years ago was awarded the Josiah Macy Jr. Foundation Award for Excellence in Social Missions for Health Profession Educational Institutions. And that's medical schools, public health schools, nursing schools, all of the different health profession schools. We're only one of 3 schools in the United States that's won that award. And then we also were awarded from the Association of Medical Education of Europe their Aspire to Excellence Award for Social Accountability. And we're the only school in the world that holds both of those awards. So, that shows that we take that large area, that regional area, seriously. And the full service residency programs that we have in Carbondale and Decatur and Quincy and Springfield, and now this year, Alton in the Metro East area, show that we have deep roots there. And then we have all kinds of services in many other communities: West Frankfort, Jacksonville, Lincoln. You can just go on and on with all of the communities in that area. It is very much a regional, community-based medical school, and we depend on each other to optimize that health for everybody in that area.
Wow. Dr. Cruz, that is just incredible. And you mentioned the coronavirus, the pandemic, and I think a lot of us are very proud of the leadership role you and your colleagues played in dealing with this terrible pandemic. I'd like to, if you would comment on about that and some of the research that I saw the other day, one of our scientists with new research on new strains of COVID-19. And so if you would talk about that and the incredible role you played, but also the research that is developing out of this.
Sure. Well, I will say this: the pandemic brought many challenges, and everybody rose to the challenges. And as it turned out, the opportunities that arose are more than the challenges. So we've learned a lot of things. The teamwork was just amazing. I'll say something about the research now. So Keith Gagnon is an RNA researcher, and you know that the coronavirus is made up of RNA and 2 proteins. So he's an RNA researcher in Carbondale, and he is with the School of Medicine and with the Department of Chemistry, on the Carbondale campus. And he did genome sequencing for the first identified variant of the coronavirus that causes COVID in the United States. And I found 2 mutant proteins on the spike protein, and found that that mutation and that variant was the dominant strain that was infecting people in the United States. So I will say this: he involved all kinds of students in that research, and he has kicked off the careers of many people. And that's the kind of cutting edge research that we have. Now, everybody else has risen up too. Now, it's a little bit of a challenge to do research, at least in the first stages, when we didn't know what was happening, and we had to keep people further apart than we do now with our good masking and everything else. But the research throughout the pandemic has flourished: Alzheimer's and aging, women's health, cancers of all kinds, regenerative medicine. If you cut your hand off, we've done the research that we know how to put it back on better than anyone else in the world. Those kind of things, all go into it. Medical use of natural therapies and research involving communities and community health, puts all of the translational research together. So, I'll just say that we've had the challenges with education too, and with the delivery of care. And, everybody has risen up. Our infectious disease specialists, our pulmonary critical care doctors in the ICU, our emergency physicians, all of our primary care physicians that are made sure that continuity of care occurred, oftentimes by new technologies. We're using telemedicine like we would have never used it had we not had the pandemic. We're using pandemic health workers, and our community health worker program is flourishing like it would have never flourished had we not had the pandemic. We're learning how to do healthcare better. because of pandemic. And we're learning how to work in new ways efficiently, work at home, work together, and work with our community partners. In all of our areas at SIU throughout the state, the collaboration with our long-term partners, with the health department and with other community partners have put together the programs that have mitigated the spread of the pandemic. And I'll just say this. So early on in the pandemic, we established the SIU Strong Pandemic Fund. And we were sitting around at one of our response team meetings, and our CMO, Harry Lawson, had the idea of SIU Strong would be something good. And so, we took that through marketing and communications and came up with the idea SIU Strong, which has been it really communicates what we're about in the pandemic. So with the SIU Strong Pandemic Fund, people, alumni, faculty, staff, students, everyone has given to that, and it's helped us procure our PPE. We have emergency funds that students have needed because their life has been difficult. We've had money that we've contributed to the food and hygiene needs throughout the various food banks and other social service agencies in the area and in the state. And also it's been used to buy that telehealth equipment. Matt, at one time during the pandemic, over 50% of our visits were by telemedicine, keeping us in contact with our patients and what they needed. We're down to about 15% now. Before that, we were way less than 1%. And we know that the 15% is about the right number for the future for the best care. So all kinds of, good things are coming out of this. And I'll just go back to the research for one more comment. We do get a lot of grants for our research from the state, federal institutions, sometimes international agencies. But researchers always need bridge money. They always need startup money. They need funds for big projects too. So the money that comes in from donations really multiplies and allows them to get that other money that's brought into the community that improves and betters the community and also provides new knowledge, which gets to our mission, better health for all. And not our mission, our vision. Our vision is better health for all. And that goes beyond the boundaries of our 70 or 80 counties. We really do envision that we are going to help make better health for all people.
Just incredible, Jerry, and certainly admire your passion, your energy, your leadership in leading that great school. You talk about giving, and here we are on the day of giving, where we're asking our folks in the SIU community and beyond to support this great university. And here's an example of truly a world-leading school of medicine. Jerry, one of the gifts you recently announced from the Smiths in Springfield, a major gift for Alzheimer's research. Could you talk about that?
Sure. Deborah and Dale Smith gave a great gift to our Alzheimer program. Dr. Erin Haskup is a PhD who is an emerging international star in Alzheimer research. She's also the director of the center. And she will use this money to actually really move some things forward right now, and we'll use some of it as an endowment. So it secures the future of what we do for Alzheimer's disease and aging. And we really look forward to becoming one of the leaders in the world in that area. And we've got a great start, and we move forward by things like the gift from Deborah and Dale Smith. Just fantastic support. And I'll also say that, interestingly enough, a portion of that gift goes to support our programs for women of childbearing age and children. And you might know that among all areas in healthcare in the United States, that's the one that's lagged behind the rest of the world more than anything else. And, mainly because of access and equity issues. So we have a program called Family Nurse Partnership. So there's a piece of that goes for that part too. So putting together the basic science research and the Alzheimer's Center outreach and the Family Nurse Partnership, it is a comprehensive gift that gets to the heart of things that are very important to the SI School of Medicine and actually important to the people that we serve.
Wow. That's, we often talk of transformation, Jerry, and you truly are transforming science, the world, the way we treat and care for folks here in central and southern Illinois, but for the entire state and beyond. It's so in your 35 years, you've been there. It's a 50-year-old institution. You've seen incredible growth, and as you look quickly back but think forward, what in a couple of minutes here, what do you see for the future of the School of Medicine?
Well, a lot of things are happening in the School of Medicine. Again, our partnerships are strong and they're ever strengthening. So I'll just say a couple things about educational programs. One of them is that our residency and fellowship programs are expanding. Now, residents and fellows have graduated from medical school. They have a license and they're here to learn their specialty so that they can become board certified and excellent in that specialty. And so those are expanding. New ones are growing. We have the new family medicine program in Alton. We have a new fellowship program in hematology oncology. We have a new fellowship program in cardiology. We're expanding a number of our programs like pediatrics in the very areas that are needed. Our medical school class size from the beginning has been at 72, but this year it went to 80 because we have a new program, Lincoln Scholars. And we're having 8 students a year who spend all 4 years in Carbondale. We can do that now because of new educational methods and new technologies. And we also, are focusing on education in the community. Some other medical schools are doing this too, and we think this is going to bring to us students who have a heart for serving the community. Actually, they always have done that, but probably just naturally, a few more of these will serve the communities that are most in need, with the medically vulnerable populations. So that's very important. I think with research, I already mentioned that we span all the areas of research now, from research on molecules like an RNA like Keith Gagnon does, and then the natural remedies and all kinds of medications, and research at the bedside with patients, and research on communities, the so-called translational research. We have a Center for Clinical Research now that helps us put that together. So we see that becoming more of a cohesive unit, with us focusing on areas where we can really have an impact, really, driving down to those things that are needed in the community. And I also mentioned before that we had started a community health worker program, which expanded into a pandemic health worker program. And, that's one that is the real continuum of care, going out into the communities, finding the people who need care, who don't trust the system. And there are many of those, and the reasons are totally valid. Understanding those things, breaking down those barriers, but letting the people in the community lead in breaking down the barriers and building programs that are needed. So taking that from the person right in the community who doesn't get care to all kinds of care that we give, all the way, back down to the care that's in the office, and then down to the bench, and then down to the molecule. That's what's exciting about it all. And and we're happy to have partners that find that exciting with us.
Jerry, incredible, inspirational. We could go on and on, I believe, and have you here for a couple hours. Unfortunately, we've come to the final part here in the last 30 seconds. We're final thoughts, and reach out to our donors, our great supporters.
I'll just say there are a lot of areas to give. And so the scholarships to the students are important. This year, first time, all students who needed some scholarship money got it. That helps them to do all the different kind of careers that might be important. Our research, faculty support, facilities, work in the community, estate gifts, naming opportunities, all those things are there. siuday.siu.edu/medicine. You can go and find 50 or more ways to give and help the people we serve. Call our executive director, Hal Smith, 217-545-2955. Our team will put things together for you and talk to you. And, we just want everyone at the School of Medicine to come through for SIU Strong Day.
All right, Jerry, thank you. Keep up the great work. And thanks for joining us today and giving us the story of the incredible SIU School of Medicine. Thank you.
My pleasure. Thank you.